Hey, good evening. Welcome to the Healthcare Reform Seminar. Today we're going to talk about the Affordable Care Act, which is the name of the law for healthcare reform. Affordable Care Act, or ACA for short, or Obamacare, the street name, they're all the same thing. Before I start, I'd like to tell you a little bit about myself, who I am, what I do. Most of you know me. My name is Vace Klavuz. I'm an insurance agent, and I've been in the insurance industry for 8 years, almost. Even though I write all sorts of insurance, lately I've been spending a lot of time getting educated on healthcare in order to educate my clients and others, like you guys. And in order to be able to write the new plans, the Obamacare plans, the so-called Obamacare plans, an agent needs to be certified. They need to get 8 hours in-person training, online training, take a state exam, get approved, and get certified. I went through all that and got certified. Besides that, I went to a bunch of seminars, attended webinars to get more educated. Do I know everything? Not even close. So when I went to the training, government training, there were a bunch of other agents, and we were all asking questions to the instructor. And some of the answers that they were giving us, I don't know. Pending to change, subject to change, we're going to find out, we don't know. So when you have questions, and if I answer you the same way, don't worry, because every day, every moment, things are changing. But you can email me your questions, and I'll find out, and I'll get back to you. So, let's start. Affordable Care Act was signed into law March 23rd, 2010. I'd like you to remember the date. I know this is not a history class, but I want you to remember this date because it's very important. I'm sure you heard about grandfathered, non-grandfathered plans. What is grandfathered? Who is grandfathered? What are the advantages, disadvantages? So if you had a plan prior March 23rd, 2010, you have a grandfathered plan, unless you changed your plan. Let's say you had a plan, Plan A, and you never touched it. You purchased it before March 2010. You're grandfathered. What does that mean? This new law doesn't affect you. Non-grandfathered means you purchase a brand new plan after March 23, 2010, or your existing plan, you made changes. If you change your deductible, that's fine. But if you change your plan because it was getting too expensive, like a lot of people did, myself too, so you lost your grandfather status. So let's say, me for instance, I had Anthem Blue Cross, and I had this plan called Right Plan 40. I purchased that 10 years ago. So I was grandfathered all this time, but beginning of this year, the premium was getting too expensive. I said, you know what, I'm going to change this. I changed it to Clear Protection Plus, so I'm not grandfathered anymore. So what does that mean? If I'm not grandfathered, my plan will be cancelled end of December. So when President Obama said, no, if people like to keep their plans, they can keep their plans are not going to be cancelled, he was misinformed. He was partially informed, I should say, because he probably meant people who had grandfathered plans. People who have grandfathered plans, again, before March 23rd, 2010, their plan is not going to be cancelled. They can continue the same way, everything is the same. They have the option to change their plan, but they don't have to. But for people who are non-grandfathered, they have three options. Your insurance company automatically will transition you from one plan to another plan. You all received something like this from your insurance carriers, end of September to mid-October. I know a lot of you are going to say, I never received this. Believe me, you did, but you probably didn't look at it, you didn't read it. And I'm in the insurance industry, I barely read it. because it's 10 pages. It's like this, and another bunch of pages here. And on the back of the fourth page, here somebody tells you, this is your plan, we're going to switch you to this other plan, and this is going to be your new premium. So barely a lot of people get this. So my plan went up 40%. And a lot of my clients, their premium went up from anywhere from 30% to 70%. So what are your options? You can do nothing and stay on this plan that they're going to switch you to, or you can tell them, okay, I don't like this plan, give me another plan, or you can go to the Covered California and purchase a plan from Covered California. What's the difference between this and a regular plan? They're the same. They call them mirrored plan. When we say Covered California government plans, it has nothing to do with government. Government just regulates it. There is no plan, no insurance company, USA Insurance or Obama Insurance. It's just still it's going to be Anthem, Blue Cross, Health Net, Kaiser, same insurance carriers. They're going to offer plans in Covered California, which is called, they call it exchange, and they're going to offer plans off exchange, which is the regular plans. These plans, if you qualify, if you're on a certain income bracket, there are some flyers out there, and those flyers tells you those flyers, which says 2013 federal poverty level. So if you, let's say you are a family of 3, husband, wife, and a kid, and if you make up to $78,120, you qualify for subsidy. What that means is you pay part of your premium and the government pays the rest. Let's say your premium is $1,000 and you make $60,000 a year. You pay maybe $500 and the government pays the rest, $500. They send it directly to the insurance company. So the first thing you need to do is find out, and those numbers are for adjusted gross income. You have to find out from your accountant how much you're making on your tax return, which is on your 1040 form, the first page at the bottom, usually line 37, it says adjusted gross income. So you look at that income, and if you qualify, then you get subsidy from the government. And also, this is the federal poverty level. If you make less than 138% of the federal poverty level, again, I'm going to go back to the same example, size of household of 3. If you make less than 27,000, you qualify for Medi-Cal. So, before, Medi-Cal also changed. Medi-Cal used to be asset, you didn't have to have assets. Now it's just income. They changed Medi-Cal also. So if you qualify income-wise, you qualify for Medi-Cal. At least you qualify, you're eligible for Medi-Cal. But unfortunately, us agents can't help you with Medi-Cal. You have to go to either Covered California or government offices to see if you qualify, and you apply through them. Any questions so far regarding grandfather, non-grandfather, the income brackets? No questions? Okay. The government plans, or the plans are going to change, as I said, starting January 1st, 2014. And there's an enrollment period, open enrollment period, which started October 1st, and is going to go all the way to March 31st, 2014. So if you don't have insurance by then, you'll be penalized. And as I said, laws are changing every day. before you had to get your insurance by December 15th, because if you get it by December 15th, effective date will be January 1st. If you get it December 16th, effective date will be a month later, February 1st. So then you'll be late and you're not going to have insurance and you'll be penalized. But since there was a huge glitch with the website, people don't know what's going on, so they changed that. You're not going to be penalized as long as you get your insurance. This is for people who don't have insurance. Your insurance by March 31st, 2014. So if you get it by March 31st, 2014, your coverage will start May 1st, but you won't be penalized. So this just came out a few days ago because a lot of people tried to go online. Online, they couldn't. Even today, online is down. They're only accepting paper applications. So you can't just go there. And starting 2014, everybody needs to have insurance. If you don't have insurance, you'll be penalized. And what's the penalty? It's $95 for 2014, $95 per adult, and half of that per kid per year, and it's not much, or 1% of your annual income, whichever is higher. Next year, 2015, it's going to be 2% of your income. 2016, 2.5% of your income, the penalty. So they want you basically to get insurance. Because this insurance, this coverage, is funded by federal government, and starting 2015, it's going to be self-funded. So that's why they want everybody to get insurance. This way, they pay, and hopefully there's going to be a lot of money, and when the insurance pays a subsidy, that's going to cover itself, and I don't think so, but anyways. Because what's going to happen, no more pre-existing condition. Anybody will be accepted. Doesn't matter what type of an illness you have, you've been rejected before, doesn't matter. Come January 1st, they're going to take everybody, and imagine all those people, they're going to have their surgeries, they're going to rush to the doctors, so insurance companies are going to be, going crazy. That's the reason why the rates are going up. So there's a misconception out there. People think Obamacare is going to make everything less expensive. Everybody I talk to, they say, oh, it's going to be less expensive, right? Wrong. Everything is going to be more expensive. More expensive, a lot more expensive. As I said, all my clients, 40%, 30% to 70%, their premium increased. Even if you switch to the exchange plans, covered California plans, those are expensive. The only advantage is when President Obama said it's going to be cheaper, he was probably thinking you're going to get some subsidy, and that's why you might make, you might pay less premium than before. But other than that, all the premiums are going to go up, guaranteed. And so new plans are going to be, there are going to be 4 metal plans: bronze, silver, gold, and platinum. The bronze being the lowest plan, and platinum being the highest plan. And of course, bronze will be the least expensive, platinum will be the most expensive. On a typical bronze plan, you have a $5,000 deductible, and your co-insurance is 40%, which means once you fill your deductible, you pay 40%, insurance pays 60%, and once you reach out-of-pocket maximum, everything is free. And out-of-pocket maximum is $6,350 per individual and $12,700 double for the whole family. Even if there are 4 people in the family, if 2 people meet the deductible or out-of-pocket, that's it, you're done. The silver plan has $2,000 deductible, and they have 30% copay, has the same $6,350 out-of-pocket. Gold plan has 0 deductible and has 20% co-insurance, same out-of-pocket $6,350. And the platinum plan, again, no deductible, and you pay only 10% co-insurance, and out-of-pocket is $4,000. So once you meet your $4,000, that's it. But of course, platinum plans are pretty expensive. And when they switch you from your regular plan, most plans are either bronze or silver plans. So if you want to, your options are, as I said, your options are, you can say, you know what, I don't like this bronze plan, just put me into silver or gold. But you pay the difference, of course. But if you go to Covered California and you qualify, you're within the income bracket, then you get some money back. And you don't get really money back. The way it works, you pay part of it and the government pays the rest. And for some reason, your income goes up. Oh, by the way, this is for 2014 estimated income. I know you only have your 2012 income return, so you don't know how much you're going to make in 2014, but they want you to estimate. And let's say you estimated $40,000, and for some reason you got a bonus, you got a new job, and you made $80,000. You have to contact them, let them know, say they can adjust your subsidy. Otherwise, you have to pay the difference at the end of the year when you pay your taxes. And so your first step is to find out, as I said, your income. Talk to your accountant and then go from there. You can contact your agent and he can help you. You can contact Covered California, they can help you. And for finding about your grandfather status, the easiest way is actually you can call your insurance carrier, let's say Blue Cross, your customer service phone number on your card. Just call them and tell them what's my status, am I grandfather, non-grandfather, and you go from there. And for people who have grandfather plans, I suggest they stay there, because the biggest difference between grandfather and non-grandfather is the provider network, the doctors and the hospitals. The grandfather, if you're a grandfather, nothing changes, you still can go to your doctors, same everything. But with the new plans, government or outside government, which we call them exchange or off exchange, the network, provider network, is really narrow. And there are a couple flyers over there too. One is for Anthem hospitals and the other one is for Blue Shield hospitals. So if, for instance, UCLA, Blue Shield doesn't cover UCLA. Cedars-Sinai is not covered by almost, I should say, any insurance carrier. So check your provider, and you can go to either Covered California or Blue Cross or Blue Shield, and it says Doctor Finder. So you can go in there and see if your doctor is part of that plan. Or you can call your doctor and they tell you. So that's the biggest difference. That's why if you have grandfather plans, I would say just stay there, unless if you switch and you save money, then that's a different story. And any questions so far? Yes.
Okay, you mentioned the grandfather plans. I think so far we are, but last year I've been getting from my insurance that they're canceling our plan. So in December, they're canceling us because they don't offer that plan anymore. Now, will we be better off waiting for that to cancel and apply something here? Or should we check with them to see if they offer another plan and stay within that insurance company? Will it make any difference on the premiums?
You are with United Health.
Pacific Care.
Pacific Care. So another thing is, good thing you reminded me, another thing is a lot of the insurance companies, they're not participating to those plans. And in order to have a plan, you have to be, there are 10 essentials. So it has to be maternity covered, pediatric, dental and vision covered, mental health. So some of the plans don't have those essential coverages, and that's why, and they say, you know what, we're going to sit for a year, let's see what happens with this Obamacare, maybe we'll participate next year. So your company is one of them. United Healthcare is another one. Aetna is another one for individual plans. So these companies, they're not going to write individual plans in California. That's why your policy is being canceled. Not because, like if you were with Anthem, your policy wasn't going to be canceled. They don't really cancel, they stop that and they start another plan. But in your case, because your carrier is not going to write anymore in California, so you have no choice but to switch to one of the other carriers. But if, as I said, for Blue Cross Blue Shield, Kaiser, HealthNet, they're not going to cancel your plan. There's this misconception, everybody thinks they're going to cancel my plan in December and I'm not going to have any plans. For carriers who write in covered California, they're not going to cancel your plans, they're just going to switch you to another plan. But unfortunately, in your case, they're not writing, so
even though they come into the marketplace later on, we'll lose our chances of being the grandfather.
Yes, because your carrier is done. It doesn't exist anymore here, right now, for this year at least. So your plan is cancelled, and when they come back next year, and you switch back to them, let's say this year you buy Anthem plan, next year you'll be a new customer. Yeah, no more grandfather status.
You talked about applications. You say you can go to California. Okay, where do you go to get the applications? Are there specific addresses that you can go to?
Well,
since we
it's
have
a maze.
online, we have to get applications.
Yes, there is. You can go in there, it says start. You click start and then follow the steps. But right now you cannot apply online. There's somewhere it says paper application. You have to print, it's I think 36 pages or so. Yeah, you have to print those, fill it out and mail it in, and it takes them 10 business days to get it. I don't know why it takes that long. And then they're going to process, they're going to approve you, they're going to check your income, and they have direct access with IRS, so they will check your income. And then they'll approve you. So it's a lengthy process. But unfortunately, the website is still not 100%, not even close. And what I tell my clients, because open enrollment started October 1st, so everybody's rushing, so let's go in there and get a plan before December 15th. But I tell my clients, just wait, because things are still settling down, laws are still changing, and come end of November maybe, we'll be ready to go full force. And I'm hoping by then, California will be full force also, and you can go online and apply. Believe me, I tried, but I can't either. I can't write anything for my clients, so I'm just stuck as you are. But hopefully they'll fix that problem. But worst case scenario, you can do the paper application.
I have a question about this poverty levels.
Yes.
This is per person or per family. Let's say 2 person, 3 person. let's say, simple, husband and wife.
It's two. Husband and wife is two.
Okay, husband and wife. Husband get the Medicare,
Okay.
and the wife goes to the insurance. This will be have.
No, it's still two.
Still.
Okay, the way this works is annual household income.
Yeah.
And they look at your tax return. Let's say it's husband and wife. You file joint taxes. And even if some people think that if I file separately, husband and wife, then my limits are going to be, individual limits are higher. So one person is 15,900, two people 21,000. So if they each apply separately, that's going to be 31,800, 30,800. So no, that's not the case. If you're husband and wife, you have to, even if you file separate, they take both incomes and account it as annual household income. If you have a kid with children, they are dependents. Household income doesn't mean underneath the house, the physical house. Whatever you show on your taxes is husband and wife, and you show your kids as dependents. You have two kids, so that's household of 4. If your daughter files separately, she works and she files separately, even though she lives with you, that's the two of your household of 2, and she has her own separate insurance. So household means they look at your taxes, not how many people live in the house physically. So, and if you, let's say the husband is getting Medicare and the wife is 60 and she has regular insurance, they look at both incomes. Even though husband is Medicare, only the wife is applying, household income is both of you. So that's a disadvantage, basically.
Okay, thank you.
Yeah. And on the subject of Medicare, I'm not an expert on Medicare, and the gentleman was asking me questions earlier about Medicare. If you have Medicare, business as usual, nothing is changing. They told me that the dental plan will be included. I'm not aware of that because I don't know much about Medicare. But if you have Medicare, Obamacare doesn't affect your policies. So, yeah, did I answer your questions? Okay.
Yeah, thank you.
And Medi-Cal, as I said before, they looked at your income plus assets. Now, it's mostly based on income. So if you're below 138% of the poverty level, you can get Medi-Cal. Even some families with income levels up to 150% of federal poverty level, they can get regular insurance, and the kids can get Medi-Cal. So it all depends on your income. And when you go, let me try, see if I can go online and maybe do. Also, there is another, so you have to go to coveredca.com. There is another website, coveredcalifornia.com, that has nothing to do with the government. Some smart guy got that name, and then people are going there and he's writing them insurance. So
And in Spanish too.
probably Armenian, right?
No, it says Espanol.
So you go coveredca.com, and this is what you're going to see. And to see if you qualify, when you scroll down, there's a calculator here. Shop and compare. Remember that, shop and compare. You click on that, and then you click get started. Here it says number of people in the household. Let's say household of 4, or give me a number.
4 is fine.
4 is fine.
4 is ideal for our being family.
Okay. Household income. Again, this household income is adjusted gross income. Let's say you're self-employed. You have a dry cleaners. You make $100,000 a year revenue, but you have rent, you have supplies, you have gas, utilities, expenses, payroll. So after everything is taken out, you make 45,000. No, I'm just. Those are just numbers. And zip code. Is zip code?
91326.
Okay, Northridge. You want me to change the income so it's closer to anybody? You like 45,000?
That's fine.
Make million. Unfortunately, you don't get any money. You don't get any help because they're thinking you're already rich, so you don't need money. Okay. Age of somebody who's 18 or over, so the husband and wife. Let's put 50. 55. Okay, then you click add an adult here for the wife.
55
Wife is 38? No. Wife is 50.
Yeah, we'll go to second wife.
Okay, now if you have a kid who is over 18, you're gonna put him as an adult. But if you have a kid under 18, let's say you have 2 kids under 18, so we click here 2. So otherwise you click here at your 19-year-old and over as an adult. And that's it. Now, come here.
Questions?
Yes.
If we're not filing those kids on our tax return, are we still gonna put them?
No. So if they're not dependents, you don't put them. As I said, it doesn't matter how many people live in the household. Who is on your tax return? If it's just husband and wife, or even single parent and 3 kids, that's 4 people. But if one of the kids is 21, and as you know, a child until 26, until they turn 26, they can be under their parents' plan. But that's the plan, not about the income. But if you don't show them as dependents, they have their own tax return, so they have to file themselves. You have your husband and wife, 2 kids, but they work, they pay their own taxes, so you're going to be 2. So you scroll down and you click see my options. And don't worry about this. This just shows you, remember earlier I told you there are 4 plans: bronze, silver, gold, platinum. And the yellow is how much you pay, and the gold how much the insurance company pays. So just click close this. Here it says bronze and silver and gold and platinum. So bronze, silver, you scroll down, and let's say the bronze. Here's the bronze. So those are the insurance carriers: LA Care, Molina, Anthem EPO, Anthem EPO. You click this here and next page. And Blue Shield, PPO, another Blue Shield PPO. This is HSA account. Only bronze plans have HSA accounts. The other plans don't have HSA accounts because they have high deductible. So Kaiser and Kaiser. Let's say you choose Anthem EPO. By the way, Anthem, there are 19 pricing regions in California. So they zip codes and they have different regions. So if you 91326 is LA. LA has 2 regions, 15 and 16. So unfortunately, Anthem doesn't have any PPO plans on region 15 and 16, which is almost whole LA County. They have EPO. what's the difference between PPO and EPO? There is almost no difference. Same provider network, same doctors. It's not like an HMO. HMO, you have to go their own doctors, and you have to go to a primary physician, and then he can send you to a specialist or to another doctor. But EPO or PPO, you can go directly to anybody you want. The only difference is, if you have a PPO plan and you go outside of the network, let's say Cedars-Sinai, it's not covered under your plan, it's not on your network, in your network, so it's outside the network. If you have PPO and go to the Cedars-Sinai, you pay 50% of the bill. If you have EPO, you pay 100%. So, well, that's only if you go outside the network. So if you're in the network, that's what I have, and you can see your network, your doctors online. Each carrier has a list that some of them are still working on it. And I have for Anthem, for LA County, but it's 700 pages. So if you give me your email address, I can email it to you. I didn't want to print that. So that's the only difference, EPO and PPO. So Anthem has EPO, Blue Shield has PPO in LA County. But again, it's not a big difference as long as you go to your provider, the network provider. Okay, let's go back here. So this plan, Anthem, bronze plan, which is the lowest plan, monthly premium for that family of 4 is $708, and those are approximate figures. It's usually a little higher. It's never lower for some reason. So $708 is the whole premium, but you get $601 assistance from the government. So you end up paying $107 a month, and then the government pays the rest. So which is pretty good.
That's based on the income we put in, right?
Yeah, that's based on the income. Remember, we said 45,000. If I put
150,000.
Yeah, then.
60.
no 150, no, not 150. We can
150, like let's see how much
just
is-
right away. We can go back. It's so easy to play with this. This is the best part of this website. But if you want to apply, look, let's say 60, because if we go over 94,000, remember, this is very important. Keep this. If we go over 94,200, you don't get any money back. You pay the whole thing. So you have to be below that. So let's say 60,000. How much? 82,000. Okay.
On the higher end.
For people?
Everything is still the same? Yeah, 4 people, ages 55, 50. You click see my option. Again, just close this one. Okay, here's your plan now. The premium,
goes up to $500.
yeah, your payment is $500 now. Yes,
The monthly premium goes up based on how much money you make?
you're right, actually it shouldn't.
That's nice.
Yeah, it went up.
It's like you're paying taxes. It's just like IRS.
You are paying taxes, actually.
Taxes. You are being taxed,
Well,
exactly.
in order to fund this, they're adding taxes. It's embedded into this $932. When you receive your monthly invoice, it's going to say, okay, $800 for this and this much for this. I believe 3.5% tax just to fund this
So
government plan.
basically, it's gonna turn out the same way the taxes, like the most making like 2% or 3% of the people are gonna fund all of this below $50,000 making people.
The people affected most about this change are the young people. People between the ages of 20 and 30, 35. Their their premium goes up drastically. I would say anywhere from 40% to some of them doubled. Because, and the irony is, they want everybody to get insured. And the biggest uninsured population is people under 30, 16%. And they want those people to buy insurance, and then they make their insurance the most expensive. Go figure. So basically they're saying, we're gonna take everybody. If you didn't have insurance before this because either you didn't have money to afford it, or you didn't qualify because you had an illness, you had previous illness and pre-existing condition. So now we're going to take you, we're going to insure you, but young and healthy, working class, middle class people are going to pay for it. People who are rich, they don't qualify, but they don't care anyways. So,
based on what? If had pre-existing problem, it's going to be higher?
no. Another thing.
They cannot be taken into account.
Yeah, they'll insure you if you have a pre-existing condition, but they cannot charge you higher rate. Before, let's say you had high cholesterol, Blue Cross took you, but instead of level 1, they put another 25% on top of your premium or 50%. Now, healthy person and pre-existing condition, heart disease, whatever, same price, it's against the law, they cannot charge you more.
This income is gross income or net?
Net income.
Net income.
Net income. Well, I shouldn't say net, it's called adjusted gross income.
Adjusted.
Yeah, adjusted gross income, which is after your expenses.
Okay.
Yes.
Question, when you mentioned that the younger generation, they got to pay a premium. If someone is a student at the age of 18, let's say, I mean, with a limited income, they're going to be qualifying for government subsidy because what happens is their income is much less.
Yeah, they'll qualify for Medi-Cal, actually. If they make less than 15,900, they qualify for Medi-Cal and they don't pay anything.
So if you have children, I mean, let's say above the age of 16, because that's the legal minimum age for them to work. If you don't show them as dependent on your tax return, provide that, you know, you can provide them with a W-2 of certain income. If they become dependent, they get their own insurance instead of you getting them as a family.
Yes, if they become independent.
Right, if they become independent, get their own insurance, government is going to subsidize their portion, and you'll be saving money if you do it that way.
Yeah.
So don't show your kids as a dependent on your tax return if you can.
If they have an income.
Right, right.
Yeah,
Provide
if they have
them,
income.
provide them with a W-2 or whatever the minimum income is, so they become dependent, so they can get their own insurance. You can save money that way. Am I correct, or?
Yes, the only thing, a lot of people don't like the word Medi-Cal. So Medi-Cal doesn't give you all those coverages that those plans do. So there's always a trick. No free lunch.
Coming back to Lena's question, like exist some of the insurance companies who don't want to be in this covered California plan and they're canceling their customers.
Yes.
So you are going out and looking for a new coverage with a new company.
Yes.
Then you are, I'm sorry for the thing, but you are going to be screwed over then. Like they are going to charge whatever they want from you. You don't have a plan. You are in need of a plan, and your your company who used to be like for 5 years, 10 years, 15 years, your insurance company canceled you. So you basically homeless, exactly, homeless.
Well,
so they can charge you whatever they want.
they're gonna do that to anybody anyways.
Yeah.
So they're not gonna just charge you anything they want. There is no difference between Lena and Nubar and myself, for instance, because my plan is not a grandfather plan because I changed it this year.
Okay.
So I'm gonna go buy a new plan. Or they're switching me to a plan, but I don't like that plan, so I'm going to buy a new plan. And they can come and buy the same plan it's going to be, if we're the same age and everything, it's going to be the same money. So just because you're joining Blue Cross for the first time, it's not like car insurance.
Okay.
They're not going to
Charge you more.
no persistency discount or anything like that. If you, doesn't matter, you're brand new, I've been with Anthem for 10 years, doesn't matter.
But this is only for individual coverage, right? Like companies, like
Yes.
companies like banks or like companies who are giving benefits to their employees, they have, this is a totally different thing, right?
Yes, it's totally different. And I'm going to talk about that a little bit and then go back to this. Companies, let's say,
Study for
you, study. Oh, there's-
These the speakers,
Okay, apologies. Okay.
That's
We're back up.
Insurance.
Yes, we got you covered. So if you have a plan through your employer and there is two sorts of groups. Small business, small groups, which is up to 50 employees. If a company has, let's say, 40 employees, that's a small group. They don't have to buy coverage for the employee. But groups over 50, like companies who have more than 50 employees or 50 full-time equivalent employees, then they have to buy the employee coverage. And they extended that to 2015 actually. There won't be a penalty until 2015. So in 2015, a company with more than 50 employees, they have to provide insurance to their employees. And they have to contribute at least 50% of the premium. Let's say the premium is $200, the company needs to pay minimum 100 and the other 100 the employee. They don't have to offer or pay for the spouse or dependents coverage. Let's say Herman. He works at a company and he gets insurance through the company, and they offer you and the kids insurance, but they don't have to contribute any money. You have to pay for your premium. And unfortunately, this is bad news for some people who get insurance through their employers. Let's say Herman gets coverage from his employer, but your annual household income is less than 94,000. So you're thinking, you know what, Talin and the kids, we don't buy insurance from the employer, we go here. And since we're making less money, we get money back. You don't. If you have access to insurance, you don't take advantage of this. So because your insurance, your husband's employer is offering you insurance, you don't take it, that's fine. Offering you insurance, you have access and it's affordable. And there is another thing, if his portion is more than 9.5% of his income, that's not affordable, so then he can say, I'm not taking your insurance, I can go here. So let's say he's making $2,000 a month, and his insurance is his portion, 50% his employer pays, 50% he pays, his portion is $300, let's say. And 9.5% of 2,000 is $1,990. But his portion is $300. That's more than 9.5. So it's not affordable anymore. So that's why then he can go here. But other case he can. Also on that subject, eligibility, people, because I had a client who was asking me the question, he's not here today. If you're over 65, but you cannot get Medicare because you don't have enough work credits, like you didn't work in the United States maybe, or you didn't work enough, so you don't have enough work credits, so you couldn't qualify for Medicare. As long as you don't qualify, so you don't have access to any insurance, that means you can go here and you can buy insurance, even though you're 65 and over. But you have to be not eligible for Medicare. And not eligible means, as I said, you didn't work enough, you don't have enough work credits, so you don't qualify for Medicare. Some people, they pay and they buy the insurance. So in their case, they can qualify for this.
I have another question. Like I hear people like with small companies, like 10 people, 15 people employing. Oh, come January 1st, I'm gonna cancel my corporate health care because it's gonna cost me too much. Okay, so what does that mean?
Well, legally they can do it. Because, again, they're small, they're less than 50 employees. They have less than 50 employees, it's a small group. So small groups, they don't have to offer insurance. A lot of companies offer because employees, they say, oh, this company offers full coverage, benefits, so that's how they get good employees. That's kind of like a trick, I should say. So, but they don't have to offer, so they can cancel. And I know a couple companies, they're going to cancel their insurance, and they're going to say, okay, well,
but
in that case, you can go here and you can
no,
buy.
like, is that like those little companies, like who are employing less than 50 people, are they going to be charged more than what until now? I don't know, like obviously.
You mean if they stay on the...
If they stay on the plan,
Yeah, everything is going up. Everything, including group plans, individual plans, everything is going up. So, but everybody's upset at President Obama and insurance companies.
President Obama is upset too?
No,
He's the one who brought it up.
no, everybody's upset at him. And well, just imagine all those people who had pre-existing conditions. Now they're going to have insurance, and
that's a good thing.
Of course it's a good thing.
That's a good thing.
We're the most powerful nation in the world, and not offering coverage to people, that was wrong. But the way this was done, I think it's not perfect. But all those people who didn't have coverage before, and they had illnesses, come January 1st, maybe January 2nd, because they're going to party New Year's Eve, so January 2nd, they're going to run to hospitals, they're going to have their bypasses, they're going to have their hip surgeries, knee surgeries, whatever. So who's going to pay for that?
Exactly, who's going to pay for it?
Insurance company is going to pay for it.
And insurance company is going to
He's going to make us pay for it. So that's why if anybody tells you, no, the prices are going to go up, this is good, don't believe them, because it can't go down. It's going to go up in order to be able to support this, in order to be able to support all those people, and also people who didn't have insurance before. Now they're getting insurance because they didn't have enough money, and now they're going to get money back. So who's going to pay for that? Insurance, government, and us. That's why they're charging us taxes. There are taxes embedded in all those plans. So everything is going up.
But all those people who are getting subsidy from this plan, they were being they were in going to, let's say, to Olive View Hospital or hospitals like that, like welfare area hospitals, right? I don't know.
Okay, their thinking was,
yeah,
all those people who don't have insurance, they go to emergency rooms.
Yes.
Even for a headache, they go to emergency rooms because emergency room is their doctor. They don't have coverage, they go there. Or for surgery, for this, for that.
Emergency room is free for people who don't have insurance?
Of course.
Of course. It's
I'm sorry, my dad was sent to emergency room.
It's not free.
They did a cardio, EKG, And they held him like 2 hours in a room, $5,000.
It's not free. It's not free. They said they have to take you. They have to take you, they'll take you, then they'll send you a bill. You don't pay because you don't have anything to pay. There's nothing for them to take from you. So those people, they don't care because what are they going to do? I don't have a house, I don't have income, so I go there, let them send me the bill.
Those are the people.
So who ends up paying? What do you think the hospital sends the bill to?
Me? My taxes. My taxes
President
are paid
Obama.
for it.
And then he taxes you. So in order to avoid that, because there's millions and billions of dollars spent every year for those emergency rooms, and the administration who came up with this, they were thinking, okay, you know what? If we have everybody insured, then these people, they go to the hospital, they have insurance, the insurance is going to pay, so we don't end up with the Olive Views or county hospitals bills. So that's the plan. But what they didn't plan on, that's my personal opinion, all those subsidies are going to bankrupt the system. That's my opinion. Hopefully it doesn't, hopefully I'm wrong, but imagine, and those numbers aren't low, those are high numbers. A family of 4, 94,000 adjusted gross income, especially, let's say only the husband works, wife and 2 kids, that's a pretty high number. So, and you see here, even in this plan, if you make 82,000, you still get $500, you still get $433 back, or help. So that's just one person, and that's 5,000 a year. Imagine all those families who are going to do this.
Do you know what they're going to do? They're going to, if 2 people in the family are working and making more than $94,000 money, so one of them is going to quit. Yeah, exactly. to make
I
it
don't know
less.
details, but it's, and if you ask my opinion, conspiracy theory, this is an invitation for them to audit you.
Exactly.
Like, well, it's conspiracy theory, but don't take my word for it. So because they're going to see all those people who are applying for subsidy, they're going to say, okay, let's start auditing these people first, rather than random people. But then again, I might be wrong. It's the Armenian is thinking.
You were saying earlier that the subsidies are eventually going to stop. So are we going to end up paying the $932 like eventually, all on our own?
No, subsidies are not going to stop.
I thought you said that.
No, if you make
In a couple of years, they're going to stop, you said.
They may.
no, I'm thinking it's not going to fund itself because everybody's going to get money out of it, so they're going to go bankrupt.
They're going to help you forever.
Yeah. Well, there is no forever, just diamonds. But it's that's the plan. No, your subsidy doesn't stop. But if your income goes up, you have to report. You have to report them because see, earlier you were getting $600 back. Now it's only $433. So for some reason your income goes high, and then or low. And while I remember that, I want to also mention the open enrollment period one more time. October 1st through March 31st, 2014. So if you don't, for now, things change, subject to change. If you don't have a plan by March 31st, you're not going to be able to buy a plan later. You have to wait till next year's open enrollment. And since this is new, this is the first time they're giving you 6 months open enrollment, October through end of March. Next year, starting 2014, your open enrollment is going to be same as Medicare, from October 15th to December 7th. So if you don't have a plan by the end of March, you're out of luck. Even if you get sick, anything, you cannot get insurance until next open enrollment, but effective date will be again January 1st. So if you don't have insurance, if you don't buy insurance till March, end of March, you cannot have coverage till January 2015.
Okay,
And even, sorry, even if you have a, let's say you change your plan, you bought a plan there now with Anthem, and come April you decided, you know what, I don't like plan, let me change it. You can't. So you cannot buy insurance, or you cannot change insurance. Once open enrollment period is over, you're stuck what we have, either no insurance or whatever plan you have. So you cannot change it either. So that's important, so you have to think about that. Only exception, well, few exceptions, let's say you don't have insurance and you want to buy insurance, the exceptions are, let's say you have a newborn, or you had insurance through your work, now either you quit, you're fired, or your employer says, okay, I'm not going to offer insurance anymore, so you're out on the open, so you can buy insurance. Or you're divorced, you're at your spouse's plan, now you're out, so you can buy insurance. So those are exceptions, but just because you didn't feel like getting insurance till March, you know what, I'll do it later, you can't, because a lot of people, friends, Armenians, you know, we always think in a different way. They were saying, you know what, so since there is no pre-existing condition, I don't buy insurance, and once I get sick, then I go buy it. They have to give it to me because there is no pre-existing condition. So in order to avoid that, they put a open enrollment period. After that time, you cannot buy insurance.
okay, but let's say you don't have insurance after March 31st, you said. Or after March 31st, you don't have insurance. You're 30 years old, 25 years, 30 years old, whatever. You don't have insurance and you get sick. And if you go to the hospital, they're not going to take you. If you go to emergency room, they're not going to take you.
They will. Thank you. No, they will take you. Emergency rooms, even with this, they have to take you.
There are millions of Mexicans, they don't have insurance, so what are they going to happen?
No, but these people, they're all going to get either subsidy or they're going to get Medicare. So that's why they're offering this subsidy, this help. If you're making, if you're making 32,500 up to anything above that, you get subsidy. So 30,000. It's not too bad. And if you make below that, then you get Medicare. So there is no reason for people actually not to get insured. And Medicare is free. And this one is going to help you to pay part of your premium. And if you have a lot of money, then you don't really care. So emergency room, the thing that they don't want you to know, and doctors have, they have sworn to help their patients. So if you go to an emergency room, they have to take you, but they basically patch you up and send you out. So even if you go to Cedars-Sinai, they have to take you, not for doctor visit or anything, but you're into an accident and you got shot, whatever, they take you to Cedars-Sinai, and they have to take you in the emergency room, but they just fix you so you're alive. Then they say, okay, bye-bye. So,
Are these in any way regulated by the government? Like, is
This
the premium gonna stay like that for a while at least? Do we know that? Or no?
1 year.
That's it.
It's going to stay 1 year. And guess what's going to happen 1 year later? Just guess. Take a wild guess. Yeah. Before, 3 years ago, insurance companies, they raised their rates, they adjusted their rates every 12 months. Then, once the law got signed, what was that date? March 23rd, 2010, they knew this was going to happen. They started increasing their rates now every 6 months. Every 6 months, yeah. So, because they wanted to get ready for this, because they're going to pay a lot of money for claims for all those people who weren't insured before. Now, the new regulation says those rates have to be good for 12 months. Instead of 6 months, now it's 12 back to 12 months. But after 12 months, it's gonna go up.
So now everything is going to be expensive in life, you know, this is going to cost money to people, so everything is going to go
So,
up.
middle class people are gonna be the ones, and the young people, before,
Young
They
people
would-
don't even have jobs, how are they gonna pay for this? Some people don't get even
Well,
permanent jobs.
they'll be part of their parents' plan, and they can even get Medicare.
So we're gonna carry them until 50 years old.
What about the scenario of a person? What about the person who is between the ages of 30 to 50, 55, and has been laid off from a job that they had for many years, and they can't find a job for the last 3 years? They can't qualify for Medicare, and they don't qualify.
Medi-Cal, they can qualify for Medi-Cal.
They go to Medi-Cal,
They can go to Medi-Cal.
they
It's-
refuse
it's
to go,
not-
they're too proud. That's another
Yeah.
one, yeah.
Yeah,
I'm serious, there are people
if
who I
you're
know
too
that.
proud, you have to swallow your pride.
Ay, 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 caramba.
Yeah, if you don't have income, you can go to Medi-Cal, and they can help you. But,
If you go on Medi-Cal, does that mean that you have to go only to certain hospitals? Or?
they have their own providers network also, and which is even narrower than Anthem or Blue Cross.
Only if you have to.
No, they have their own. No, you can go to a few hospitals. I don't know which ones, because I can't do Medi-Cal, but it's not as bad. It's not as good as these, but not as bad. So it's better to have Medi-Cal than have nothing.
My understanding, to qualify for Medi-Cal, the person has to be almost disabled.
Not anymore.
So now you're saying that the factor is just income?
Yes.
They don't have to have any medical condition?
No. You can still get Medi-Cal if you're disabled, if you're this and that, but if you're
Just based on?
under 65, yeah, just based on income. They part of this law. And if you go to the government office, the medical offices, they try to tell you, oh, assess this and that, but no, because they're trying not to provide, I guess, coverage. And but by law, it's just income.
My employer open enrollment is April through May, and I do belong to Pacific Air, and if Pacific Air is not participating,
Individual market. I don't know about the group market. The group market, the employer market is totally different. So this is just individual. Yeah, they might. I think they are in the group market. I'm not sure, but individual market they're out, but in the group market it's totally different.
Okay, I mean, they were doing all this plan and they knew everything's gonna go up. I mean, it's expensive, and the wages are still the same. So it's gonna be, life is gonna be really expensive. I mean, everything is gonna add up, you know?
Yeah, don't shoot the messenger. I'm just.
Didn't they figure it out? People are gonna get poorer.
That's why the government closed.
But I mean,
The fight was going on.
everything is gonna get expensive and our wages are still the same.
Absolutely.
Burada yine vermeyelim, ama çıkarsın.
But this will actually, you can take advantage of this. See, your wages are going down. That means you qualify for more money. Okay, let me show you. Let's see what happened with gold plan. Gold plan, of course, see, they still pay you the same amount, 433, but your premium goes up, and you end up paying $800. So those are better plans, and from my experience, you guys want to give a 5-minute break? Coffee break, or everybody okay?
No, that's okay.
Continue? Continue, okay, continue. No, I'm good. I'm fine. Zanka.
Settle down.
So, okay. So, from my experience, I don't like the bronze plan. And you're going to say why? It's the least expensive, but on the bronze plan, oh, by the way, let's say, go back to bronze plan, you'll see. So you know how to get there, right? And on the bronze plan, let's say you choose this and you click on view details here at the bottom. You click this, and then here, view plan benefits. It's pretty self-explanatory. So you have $5,000 deductible and family deductible $10,000 because it's doubled. If you go to a primary care visit, it's $60 copay, specialty $70 copay, urgent care $120. Here it says generic medication copay $19. Well, that's not correct. It is correct, but first you have to fill this deductible. Medical deductible and prescription drug deductible is combined. So let's say you never go to a doctor or hospital and you buy medication, first $5,000 you have to pay out of your pocket. So medical and prescription drug deductible is combined. Then you pay $19. So that's why. Basically there is no prescription coverage until you pay your deductible. Then it's $19. That's what I don't like about the bronze plan. So this is how you can go into details. Then you can close this.
What's the difference? I'm sorry. What's the difference between primary care and preventive care? It says for no cost.
Well, preventive care is
annual checkup.
Well, annual checkup. People get confused about annual checkup. Is the doctor here? Annual checkup. They say it's. Everybody thinks that annual checkup once a year you can go free checkup. That's not correct. They only give you few things free, like not even if they do an X-ray, EKG, labs. Those are all they all charge for those things. Just I don't know. They just it's kind of like an office visit. So nothing is free.
What about
on the annual? That's the annual checkup. But preventive care is mammogram. Mammogram is preventive care. For kids, vaccinations is preventive care. And
Colonoscopy.
yeah, colonoscopy. But again, there's a trick that insurance companies use. So you have to talk to your doctor. The way they bill the insurance company. If you go to your doctor and say, I feel some discomfort on my breast, so I need a mammogram. That's not preventive anymore, that's diagnostic. If you go to your doctor and say, you know what, I'm over 40, let's do a mammogram. That's preventive. Same thing for colonoscopy. My bowel movement is strange, I have abdominal pain, you know what, let's do a colonoscopy. That's not preventive, that's diagnostic. So you have to pay for it. But if you say, I'm over 50, or I'm over 40, but I have a history of cancer in my family, so you know what, let's do a colonoscopy, see where we go from here. So that's preventive. So you have to be careful when you go to your doctor, you have to tell them the way to bill their insurance company, your insurance company, otherwise you end up paying for it. Yeah, so the insurance companies, they're evils. So they try to not pay you, not pay the doctors, not pay anybody, but their own people. Own pocket. So they try to, cut corners. You have to be careful. But preventive care is included, and child like vaccination and all that stuff. And why do you think those plans are expensive? Because all those plans now have maternity included. Let's say Alex goes and buys his own policy. Single guy.
If he has the money.
He doesn't need pregnancy. It's embedded, which doesn't make really sense. A single guy has pregnancy plan, and his plan also includes pediatric, vision, and dental. He doesn't have any kids, but he pays for my kid's plan, basically. And with those new plans, pediatric vision is included. Some of them have dental, some of them don't, but they make you purchase dental also. So that's why all the premiums are higher. So there are a lot of coverages, but for some people they don't need it, but they pay for it, unfortunately.
Well, how are they gonna find out and penalize you? Let's say you don't have insurance. Let's say, like, there's still 10 more months, but let's say Alex doesn't buy himself insurance next year after he's 25, after he's 26, and then, like...
Tax returns. That's how they find out.
If he has a job, tax returns.
Yeah, well, yeah, they have direct access with the IRS. They'll check your tax returns, and if you tell them...
If you file for tax return, they will ask for medical...
By the way, I don't know if I mentioned, you have to estimate your 2014 income. Those numbers are for 2013. So you have your 2012 returns. You don't even have your 2013s. You have to estimate your 2014s. And you estimate wrong, you have to call them and have them adjust up or down. There is no penalty. There is no penalty, no interest. But you have to pay the difference when you pay your taxes. But there is no, like, when you don't pay your taxes, there is penalty and interest. No penalty or interest. Just you pay the difference. Yes, sorry.
Which brings a question to my mind. I mean, since it's based on the estimated upcoming years income figures, that those individuals who are qualifying for subsidy, let's say in the upcoming year, the individual's AGI goes up by 100,000, they win a lottery, something happens. What happens? Then they get penalized when they're filing the tax return afterwards?
They don't get penalized, they pay the difference. Let's say they had this plan. They were making 82,000, and then their income went up, and they made 150,000. What's going to happen? They're going to end up paying all that subsidy back, right, because they're making more than 94,000, so they don't qualify. But they got $500 help every month, or $400 help. That's $5,000. So they have to pay that $5,000 back.
Probably with penalty.
No, no penalty.
No penalty.
No penalty. No penalty, no interest. But you have to pay it back. Well, but you made extra 70,000, so.
So if you don't get insurance by March 31st, when is the next open enrollment?
October 15th through December 7th. But that's the time you can buy insurance again, but your insurance is not going to start then. It's going to start January 1st, 2015.
So from March 31st through October, you pay that $90 a month for adults for your penalty?
No, it's not monthly. It's per year. $95. $95 per year per adult plus $47.50 per kid. But there is a $285 cap or 1% of your income, whichever is higher. On the $95, not on the 1%, whichever is higher. If the 1% is higher, you pay the 1%. If you're making, let's say, 100,000, you pay $1,000. Otherwise, it's got to be 95 plus 95. That's 190 plus 47.5. So that's 200 something. But you pay the more expensive one, which is the 1%. So they want you to buy issues. I know the penalty is not that bad. Some people think, you know what, if I'm making 50,000, that's $500 a month, a year. I'm going to pay $500 a month here. So I'll take the penalty. I pay 500 rather than once, rather than paying it every month. But then you're not going to have insurance. And the penalty is going to double next year, and more next year after, and so this year it's low, considerably. So, any other questions?
You can always negotiate a cash price with your doctor. Right?
Yeah, well, even a lot of people nowadays, they have hospital-only plans. Just for catastrophic events. They say if I get into an accident, I get surgery. So they have high deductibles, 5,000, 7,500. Because lately everybody was increasing their deductible to lower their premium. And if you have a 5,000 deductible, if you go to a doctor every day almost, you're still not going to be able to fill your deductible. So that's why they're thinking, if something happens, I pay my doctor even cash. But if I'm in the hospital, operation, then at least I have some coverage. So they're not going to take my home from me. So that's what insurance is for. You're insuring your home, basically, not your...
Because the sad thing is that, I mean, as you and I discussed this, Vace, it's unfortunate, like an MRI, that they bill you roughly about $2,500. If you go to the facility and say, don't bill my insurance, I'll pay you cash, you get an MRI done for $600. But if they bill your insurance, even with the PPO adjustment, you still end up paying more than $600, and plus you're paying for insurance premium, so what good is that you have insurance?
Exactly.
It's sad. It's a messed up system.
Yeah.
Yeah.
Second that.
Yeah.
So, what else?
Now it's illegal
We
not to
covered
have insurance.
penalties, income brackets,
You have
enrollment
to-
periods, and
So we pay the penalty and we pay cash under the doctor. And then
so bottom line is, and by the way, those plans, let's say you make more than 94,000, right? If you're a family of 4, you make more than 94,000, so if you don't qualify for subsidy, you can still buy from Covered California. Actually, they want you to buy from Covered California because people like you will be funding this. If you're making more than 94,000, you don't get any money. You say, oh, okay, then I just go to regular Anthem and I buy from them. They don't want you to do that because then they don't want just people who are getting money from this plan. They want people to pay also. And there is no difference. They call them mirrored plan, like mirror. It's the same plan if you buy it from here, which is an exchange, or from off exchange. It's same. It's still Anthem or Blue Shield. Anthem has a plan here, and outside this, Anthem has their own plan. Same plan, same coverages, same premium, same doctors, same hospitals. Exact same thing. No difference. The only difference is you get money here, you don't get money there. Plus, here is a lengthy application because they ask for your income. On a regular Anthem policy, they don't ask you for any income questions because they're not going to give you any money back. So no income questions, no health questions, remember no more pre-existing condition. So that application is going to take 5-10 minutes. This application is going to take a couple hours. If you already know which plan you want. If you go, should I go bronze, should I go silver, gold, then that's going to take some extra time. So the only difference is this application is longer, the other application is shorter. First we thought that the network, provider network, is going to be different also, but they said no, everything is the same. That's why they call it mirrored plan. Just the names are different. For instance, Anthem, on a bronze plan, it's called direct access. On a silver plan, the Anthem side is called essential. So just the names are different to be able to differ the two of them. But otherwise everything is the same. So
Are there any other health plans that are not on this site that's available to people, or this is it?
You mean,
On this California, covered California, whatever is listed on this.
whatever is listed?
This is it.
This is, yeah, there is basically Blue Cross, Blue Shield, Kaiser, HealthNet, and Molina, and something else. LA Care.
Scan.
Scanner, Aniga, scanner, Panorama, Medicare, 65 and over.
So I'm in Medicare now, have nothing get done. When I go on Medicare next year, let's say, is it gonna be only Health Net?
No.
Or
No,
they
Medicare.
Do they choose what I get, or do I get to choose what I want?
You choose what you want. Or Medicare, or the government part, yeah, the supplement you choose. No, you can choose your own plan also. That's why, right now, if you're a senior citizen in your home, you're getting a lot of mail from even Anthem, Kaiser, Scan, all those people, they're saying, switch to us, basically.
That's for the supplement.
Supplement, yeah.
I'm asking about Medicare part.
Medicare itself, I'm not sure. I'm not sure. I'm not too familiar with the Medicare part.
Okay, somebody has a hospital plan.
Which company?
You have to buy also health plan?
And
Hospital plan as an individual?
Yeah.
Well, those plans, those hospital plans are not going to exist anymore because, yeah, they have to be,
I pay, still pay.
they have to be ACA compliant. But do you have doctor visits in there too?
No. Hospital, I said.
Hospital only, but which plan is it? What company?
Blue Cross,
Blue Cross? What's the name of the plan?
1,000 plan.
Oh, the basic 1,000? Yeah, they're, because your grandfather, those are old plans, so nothing is going to change.
No change.
Those are old plans.
But we have to buy health insurance too?
No, this is your health insurance. That's your health insurance. Remember, grandfather plans are not affected from this law. Basic 1,000 or basic 2,500, those are older plans. They don't exist anymore actually, but you're still going to have your plan because it's a grandfather plan.
But it's only hospital.
Yeah, it's only hospital.
But is it covered doctors too?
No, no doctors.
You have to buy it.
You don't have to buy, you have to pay the doctor.
No.
You don't have to buy a separate insurance. You can cancel this one, buy a brand new insurance. But you don't have to buy, you have hospital only, there is no such thing as hospital only, okay, let me buy a doctor plan also.
No, you cannot.
No, you cannot. You have to change your plan, or when you go to doctor, you pay out of pocket. Okay, I guess we covered pretty much everything.
Thank you, Chair.
And I have some cards already. If you have any questions, you can call me, you can email me, and I'll be happy to answer this.
What are the odds that this Obamacare will not last? Like, you know, like
Well, remember, when Medicare first started, a lot of people were skeptical about it. They thought this wasn't going to last, it's going to bankrupt the system. A lot of doctors didn't participate, but now look at where we are. So this, they're saying give it a couple of years.
there are some good things about it, like the pre-existing conditions, most important. Those are like